record button now so we can begin. So welcome everyone to today's Association for Multicultural Counseling and Development webinar, Unapologetically Asian, Anti-Oppressive Counseling and Racial Healing Practices for Asian and Pacific Islander Communities during COVID-19. We are so excited to have you all here today, and we're looking forward to the discussion by the panelists. So with no further ado, I'll go ahead and get started introducing our panelists and then our moderator, and turn the floor over to Dr. Chan after that. Dr. S. Anandavalli is an assistant professor at Southern Oregon University. She is committed to incorporating Indigenous and Black feminist paradigms into social science research and clinical practice. She also offers pro bono and low-cost mental health services to clients from minoritized communities in rural Oregon and serves as co-chair for the Women's Concern Task Force for AMCD. Dr. John Harrichand is a Canadian and Chinese East Indian ancestry and was born and raised in Guyana, South America. He's an assistant professor of counselor education at the State University of New York at Brockport. He publishes in the areas of counselor education, leadership and burnout, LGBTQ+ issues and counseling, professional and social justice advocacy, and international counseling students education and retention. He serves as the chair on the ethics committee for AMCD. Dr. Shreya Vaishnav identifies as an Indian American immigrant who grew up in Mumbai, India, and migrated to the United States at the age of 18. She recently graduated with her doctorate in counseling and education development at the University of North Carolina at Greensboro. Her research interests focus on racial microaggressions in academia, mentoring, counseling students and educators, and social justice advocacy. Dr. Catharina Chang is a professor at Georgia State University and the director of international programs for the College of Education and Human Development. Dr. Chang's primary areas of interest include social justice advocacy, multicultural counseling competence, counselor training and supervision, and counseling implications related to Asian American and Korean American clients. She has held several leadership positions, including the president of the Association of Multicultural Counseling Development, currently serves as the chairperson for the American Counseling Association Foundation. Dr. Hyun is an associate professor and chair of the school counseling program at Seattle Pacific University. Dr. Hyun teaches multiple core school counseling courses, and her scholarly work and presentations cover multicultural counseling in K-12 schools, school counselor supervision, and play therapy integration into schools. She has provided play therapy for K-5 kids and parenting workshops for Asian American populations in the greater Seattle area. Dr. Monica Band is the owner of Mindful Healing Counseling Services, LLC, where she works primarily with culturally diverse couples and individuals providing mental health and career counseling services. Dr. Band is an adjunct professor at Marymount University in Arlington, Virginia, and teaches career and group counseling. She currently serves as a VP of Asian American Pacific Islander Ethnic Concerns for AMCD. Finally, today's moderator will be Dr. Christian Chan. Dr. Christian Chan is an associate professor in the Department of Counselor Education and Development at the University of North Carolina, Greensboro, president-elect of the Association for Adult Development and Aging, and proud queer person of color. Dr. Chan is a scholar activist with diverse interests, including intersectionality, multiculturalism in the counseling practice, supervision and counselor education, social justice, and activism. With no further ado, Dr. Chan, I will turn the floor over to you.
Thank you, future Dr. Janelle Jones. Thank you so much to Dr. Tanya Tinsley and Dr. Christopher Holloway for allowing us and embracing the space and sharing it with us. I think in many ways we are seeing so much of where we're linking up so much of our solidarity and our activist efforts in ways that can not only be resistance work, but also work that can be healing. And so before we get started with our panel presentation today, I wanted to turn it over momentarily to Dr. Monica Ban, the Vice President of the AMCD Vice President of AAPI Concerns, for a statement on solidarity and a moment of silence.
Hi all, thank you so much for joining us given this time. As VP and as a representative of our community, I wanted to take a moment to create a call for action and a solidarity here. As a community, the AAPI community, we have a space and a fight in this dialogue for social justice. What happened to George Floyd and countless others today, I live in DC for those folks who don't know me, and around other cities is appalling, unheard of, horrific, and yet we know as people of color that this is actually no new news to us, especially in our experience in America. I want us to consider those who are in the AAPI community to begin to dismantle your own internalized racism and your own internalized whiteness. I want you to begin to think about how we in the AAPI community have received privileges for being white adjacent and leaning into the model minority myth. Yes, it has come from a place of hurt and assimilation and acculturation for our own survival, but we also need to rise up and recognize that we have benefited from being silent at times. And we also need to be able to speak out against these injustices in relation to the Black community now, because we are all part of this and we know what it feels like, right? So while this is not about us and our narrative at this moment in time, we are directly connected to this, and we need to begin to own our privilege in the ways that we have taken from this and remain silent. So as we begin our own deconstruction process and our own internalized whiteness and racism, I want us to be also considering and respecting the Black community for all that they have done and continue to do, and how exhausting that can be. I want us to take a moment of silence now to honor and respect George Floyd in giving his life to create this global movement for us and many others, maybe for the first time, to finally consider their role in this. So without further ado, I know Dr. Chang will be taking that moment for us, and then afterwards, we will be getting into our panel discussion. Thank you for taking this moment to listen to me and also to reflect on your own needs and your own privilege in this time.
Thank you, everyone, for honoring that moment of silence. I also want to thank Dr. Band for starting us out and kicking off this panel with a statement of solidarity. As you probably, for anybody who knows me or gets to know me, that I am not in the business of sugarcoating. And in many ways, so much of the work that we are doing today is contingent on denouncing anti-Blackness, denouncing white supremacy, denouncing racial violence, and naming those factors and mechanisms within our society. I think in many ways, and I've collected a group of phenomenal panelists, scholars, leaders who reflect so much of the work that we're doing in so many of our spaces, right? As practitioners, as scholars, as researchers, as supervisors, as counselor educators. I think in many ways, what I have been seeing, right, over the past few months have been deeply disturbing. I think it begins, in many ways, I think about some of the work that we have seen, and some of what we have also gathered, listened to, and I was reading this op-ed and reflecting on it, and really, by Andrew Yang, and seeing that, Asian Americans can be the cure to the virus. And so on a headline, right, that seems to be promising, that seems to be empowering, but then when you actually go deeper into the article, what it's basically saying is it's saying that we need to be more, as Asian Americans and Pacific Islanders, we need to be more patriotic, and we need to be, uphold all these American values and citizenry. And I think here's my problem with what that statement says, is that it reinforces so many of these structures, right? And reinforces that communities of color have been at the root of the problem, and that it's not because we're doing enough to certainly be more American, to be more part of the United States society. And I think in many capacities here, we're also seeing this. I want to connect with Dr. Tahari Jackson's work, particularly on the downward gaze, and saying, again, this is very connected to some of Janet Helms's racial identity development work, particularly around white racial identity development. And when we think about that status of pseudo-independence, acting as though, yes, racism, we all acknowledge racism is a problem, but when we're thinking about it, pseudo-independence basically perpetuates this idea that we all think racism is a problem, but communities of color need to navigate it, to manage it, to handle it, and to address it, and to be the ones to intervene. So as you can probably see, that there are a lot of different issues with that. And so today, as we bring forth this conversation, we hope that this is, like Dr. Ban was saying, a call to action, and one where we think about racial coalitions, where we think about racial coalitions across communities of color, and where we think about solidarity. One where we're not just thinking about passive means of allyship, right? But thinking about active processes, that it's on an ongoing lifelong commitment to this work of solidarity. And that, I don't sometimes really necessarily just like the word ally, but I think about word solidarity, right? Because I think when we think about allyship, what happens is that we often see this across several historically marginalized communities, that allyship is contingent on getting a sticker put on your back, and getting a pat on the back, getting a sticker and then getting a pat on the back. And to that end, we have a multitude of voices here with us today. Voices that are reflected across different specialties. So we have faculty, we also have faculty, practitioners, leaders who have different specialties within counseling: marriage, couple, and family counseling, clinical mental health counseling, rehabilitation counseling, school counseling, and college counseling and student affairs. So again, a lot of different voices and expertise here. And we also have something that's really cool, is also really acknowledging that we have private practitioners here with us today. So I just want to, and our work continuing in community agencies and schools. And so I want to say thank you all to the panelists for sharing your insights and expertise today. So just to start us off here with a question, the first question I wanted to pose to the panelists is, what are some of the major implications for professional counselors in serving AAPI communities, Asian American and Pacific Islander communities during COVID-19? And I'd like to go ahead and start with Dr. John Harrichand.
So thank you, Dr. Chan, and thank you everyone for joining us today, and especially to the panelists for allowing me the opportunity to be part of your community. As we begin, I would first of all encourage us to, with whatever I'm going to share, but I guess also in general, whatever we're all going to be sharing, to take a position of what we refer to as cultural humility. And we've heard about it, we teach about it within and throughout our programs, but I think as recent events, even as we look within our community as well, we've seen that has in and of itself been something that we forget. And I want us to be mindful of it, especially throughout our presentation or panel discussion today. So in answer to Dr. Chan's question of what it is that we as professional counselors need to be doing, is to first and foremost be checking ourselves right? And what does that mean? Checking our own biases, checking our own stereotypes as to where we stand on issues that are affecting us as a community within the AAPI community, but systemically, what's happening within our world. And as we're doing that, we want to be sure that we're in a space that we say, I know where it is that I experience privilege, where I've potentially at some points hidden behind privilege, and therefore also what it is now that I've been called to do as a professional counselor that is outlined within our ethics, and within our identity of who we are. So being mindful of that, that's one of the first things. In that same space is also looking at it from the perspective of how is it that we are understanding issues related to xenophobia and xenophobia within our community specifically. So how is it that when we hear the terminologies being used, asking ourselves, why is it that I might be reacting a certain way towards the terminology? What place is that holding within my own narrative and how I interpret it, how I navigate spaces where those words or people groups who might actually hold to those identities in and of itself. So being mindful of that as well, and being able to challenge that when and where we see it, but also doing so with hindsight of ensuring the safety of those around us, especially our clients, if we're going to ask that of them to do as well. So that's from one level. Then another level, and if I kind of like imagine this, I really do see it as in terms of a systems perspective as to moving within ourselves and then moving out from outside and then engaging the different levels within our system. So if we're moving from that space, is that saying that now that I've addressed that intrapersonal dimensions of these issues, now what is it that I'm looking for in terms of, again, using that same cultural humility perspective and saying, where am I going to come from in trying to educate myself? We cannot be putting the onus or the responsibility on our clients to be the ones educating us. We cannot be putting this onus and responsibility on other people within the AAPI community or anyone else without us first taking our own responsibility and ownership to say, this is what I lack, where I lack knowledge, and this is what I'm actively doing to pursue professional development opportunities that give me that knowledge and insight so that I can sit with my clients, that I can sit with members within who I agree with and disagree with, and have constructive, respectful conversation. Because I think we sometimes, a lot of the times, we end up throwing that out of the window, the idea of engaging in civil discourse when it comes to these issues that are emotionally charged. And I think that we as a society, and I'm not even sure necessarily if we can say this within our own counseling profession, but I think we have done, in a sense, an injustice of saying that, we equate these issues to being very emotionally charged issues in and of itself from the onset. So we go in with a preconceived notion that, you know what, this is going to rile up something within me. And so I already come at it, in a sense, from a defensive position at times, and that in and of itself hurts the conversation and prevents us from moving forward in any sort of constructive way. Oftentimes that happens. So again, moving from that perspective of educating ourselves as to what is it that we see within the AAPI community, as a collectivist culture, as a people group who oftentimes try to contain issues, especially issues, whatever those issues might be, whether it be personal or as it's experienced systemically, but we really do try to keep that within our own ourselves, usually within our own family systems, and not try to go outside willingly to say, let me go and share this with someone else that is, especially who might not look like me, who might not understand me, and seeking out that sort of help when it is that we need it. And when we do end up doing so, it is usually prolonged period of time might have passed where symptomologies might have worsened, that then we're kind of like looking to, as a community, pick up pieces where if earlier intervention might have taken place, that could have been, in a sense, prevented significantly. So from that space of looking at the individual and what is it that I need to be doing or we need to be doing as a community to educate ourselves, is also moving to the position of understanding to other issues within within the AAPI community and how we might understand or value things like family community, understanding this or honor system, understanding how it is that we respect or we look for ways wherein we can, or family name in and of itself is the thing that is really significant to us and valuable to us, and how is it that we preserve that through, usually we do so through the use of our own educational attainment, professional attainment, and how that in and of itself, within the context of what's happening within our community of experiencing xenophobia, how that in and of itself is impacting us in terms of challenges and saying, are we okay in navigating these spaces? What is it then, how are we going to be interpreted or be portrayed, or we're being portrayed, and how is it that we're going to then move past all of this, in addition to trying to, as Dr. Ban had shared, this model minority myth, how is it that we're kind of like moving through that space at the same time as trying to challenge the norms that we're facing within our society? And then as we move from that perspective, is to start saying too, from a perspective of advocacy within us, as to what is it that we should be doing as professional counselors, but more so as individuals who are wanting to, who are currently might be part of the AAPI community, but even those who are seeking to stand, as Dr. Chan is saying, in solidarity as opposed to allyship with the community, and saying that what is it that we need to be doing in terms of, first of all, educating, which is I'm thankful that AMCD is providing this forum for us to do that. And so that's one way of moving into areas of civic responsibility, right? So where is it that we have a responsibility to take on leadership positions, where we could invest in policy changes specifically that then attend to the needs within our community? And then as a third option too, is to say, how is it that we start having these individual conversations and not minimizing the fact that we might be having individual conversations, because that's a really important starting place, but then moving past those individual conversations and saying, where are we going into institutions as professionals, as counselors, as educators, as clinicians, and saying, where is it that we're taking this dialogue and trying to bring awareness and not just in terms of educating, but then call a charge to a call for action, right? So those are kind of like some of the things that I see within our community where we as professional counselors could be actively working in challenging the issues within which we see and we face today. And I'll turn it back over to you, Dr. Chan.
Thank you, Dr. Harrichand. I'm wondering if some of our other panelists would like to contribute in response to this question.
I think from a practitioner standpoint, in relation to COVID, what I've been seeing is a re-traumatization of our fear-based responses that are exacerbating social anxieties and OCD-like symptoms for many of our clients. This idea that I am feeding into this perpetual foreigner stereotype in the way in which people are viewing or looking at me, even if it is I'm experiencing this fear, and how I'm viewing that is maybe I'm paranoid, but now I'm feeling stigmatized for being paranoid, right? Sort of in the same sort of covert effect that we get from microaggressions. And so I'm seeing a lot of, in relation to OCD, I'm seeing a lot of, I am not clean, right? I am not safe, you know, similar rationales that we would typically be seeing, but in the context being exacerbated by these messages, in addition to thinking about where these messages are coming from and what states of general authority they're coming from. And so as we're thinking about, well, that's one thing if I think about that internally or society and I can't quite pinpoint exactly where those messages are coming from, but when they're coming directly from news sources and the president or someone else of power and authority, and I'm reacting and responding to that, and I'm watching people use that similar language, or I'm having people clump me in. I am not from Wuhan or I'm not Chinese, but it seems that I'm again being clumped in to this kind. So it's a complete erasing of one's identity in many ways, and then also a minimization of the paranoia and the increase of symptoms one feels, because do I have a right to feel this way? You know, if these powers or these systems are telling me that maybe I am part of the problem. And so we can see a lot of distorted thinking in that. And we can see a lot of shame cycles that keep occurring. And so it can often, at least again from a practitioner standpoint, I'm seeing sometimes family and system enactment within receiving some of these larger structure narratives or messages. So I'm getting that message from the president, or if I'm getting those messages from my news sources, and I am thinking that those around me or in the grocery store are avoiding me because they think that I have some type of connection to this, then I'm going to feel shame. It must be me. I'm going to feel shame in that. If that is already a familiar feeling, or my automatic nervous system is firing off, and I'm feeling that fear, that fight, flight, or freeze, I'm going to be feeding in and internalizing those narratives and stereotypes. So I just wanted to add that again in relation to what Dr. Harrichand said, both from a theoretical and perspective, to kind of add and kind of offset with a kind of just what I'm seeing on the ground in that way. Yeah.
Hi, I'm June. I'd like to add a little bit on what Dr. Ben mentioned about that internalization of that locus of responsibility. That's very good, usual tendency of Asian American. I will have a kind of time for myself to answer kind of what would be the important cultural factors to broach among AAPI students, clients, and families related to COVID-19 a little bit later. But Dr. Chen, please allow me to kind of chime in a little bit on my part, because it is related. Because one of the things that I would like us to think about as a practitioner in helping Asian American population, I think it's one of the things is that the locus of that responsibility. When we think of that Dr. Su's word view, there are 4 quadrants based on locus of control and locus of responsibility, whether it is external and internal. And more likely in Asian American Pacific Islander community, of course, it's diverse. Individual by individual, it'll be different, but more tendency is that in Asian American community is that when things are happening, okay, who is in control? Maybe the system, but who is responsible? Oh, I am maybe. When something happened, is it me? What did I do wrong? So they are more likely to internalize the things on themselves and blame on them. And that is really not helpful for Asian American Pacific Islanders' identity development. And I think that it is impacting the cultural identity as an Asian American living in the United States with all kind of things were happening here.
Can I also add to Dr. Chan, the possibility or the reality that we're seeing this take place, just the beginning effects of this, the impact of what this virus has resulted on our identity, and knowing within from a trauma narrative is that these things are usually going to rear their head much later down. So being prepared now, but also knowing of the impact that this is going to have as a long-term issue within our community. So being mindful of that.
All right, I'm going to go ahead and jump into the next question here. So the next question I have for the panelists, reflecting upon culturally responsive practices, how can professional counselors assess for direct and indirect effects of oppression among AAPI communities? I'd like to start with Dr. Catharina Chang for this question.
So, hi everybody. Thank you, Dr. Chan. You know, I thought long and hard about how I wanted to respond to this question about the effects of oppression on the AAPI community. And there are lots of different ways I could have approached this question. I think one approach is to say, you know what, if you're part of the AAPI community, it's safe to assume that you are somehow impacted by oppression. Some of you may not be as aware of the Asian American history, but within US culture, within UN society, Asian Americans have long withstanded systemic discrimination and institutional bias. There is a history of legal restrictions based on housing restrictions, education limitations. Asian communities have been taxed with ethnic-specific business taxes. There have been immigration laws, including the Chinese Exclusion Act, the Gentleman's Agreement, that have all inhibited the rights and freedoms of the Asian community. And not too long ago, we had the Japanese internment camps. And so historically, within the US society, the AAPI community has experienced systemic and institutional bias. And so I think it's safe to assume that in some part, this community, our community, has always been impacted by oppression. The other piece is, you know, I could take a very academic approach, and most of you probably already know that we know what the effects of discrimination are. We know that discrimination directly impacts us physically, mentally, socially. We have research that supports that. And so what I would like to do is take more of a personal response to this question, because as I've been experiencing, as all of us on this call, just the impact of COVID, but also the impact of George Floyd, the impact of Diane Taylor, the impact of Ashad Aubrey. This is becoming more of a personal issue for me and my community. And as I think about my own experiences with oppression, I'm a first generation Korean American immigrant, first generation college student. And, you know, I can share with you lots and lots of stories about microaggressions that I've experienced, being called names, being yelled at, you know, being ignored when I go shopping. And so as I think about how would I like someone to approach me in terms of working with me and helping me think through, process my own experience of oppression, I also then put on my counselor hat. And we know that there are lots of different empirically based interventions. We know that they're culturally responsive. But at the end of the day, we also know that the most effective way to impact change with our clients is to be with our clients and to hear their narratives. And so as I reflect on this question, what I really want to do is talk about how we as counselors and we as counselor educators must connect with the people that we engage with. We have to connect with our clients. We have to connect with our students. We have to connect with our families, our friends, and our communities, because it is through that one-on-one interpersonal interactions that we can make small changes. I know that there's a big movement for bigger change, and that's also important. But I also think that if you want to change how somebody feels, if you want to change and help someone work through being a victim of oppressive society, being a victim of oppression, and changing that narrative to being a survivor, that happens more at the one-on-one level. And so as I think about how do I, as a professional counselor, assess the direct and indirect impact of oppression, I would encourage all of us to think about, what did we learn in basic skills? How can we connect with our clients? How can we encourage them to tell their stories? You know, I absolutely agree with what others have already said about, you know, we need to keep in mind where the locus of control is, locus of responsibility. And we know that within the Asian community, we tend to hold a lot of responsibility internally. Some of you may or may not remember or be around in 2007 when we had the Virginia Tech shootings. And this was a a Korean American student who went and shot people on the campus of Virginia Tech. And I remember having a conversation with my parents, and the very first thing they said to me was, and this is before they knew who the shooter was, I hope it's not an Asian. I hope it's not an Asian. And when I asked them about, and that's a strange response to that sort of happening. They were devastated that there were shootings, there was hurt, but their comment to me was, anytime something bad happens at a national level and it's an Asian, every single Asian suffers because of it. And every single Asian is blamed for that behavior. And let that sink in. Anytime something happens at a national level and the perpetrator or the person responsible is an Asian, at least those in my parents' generation, they feel personally responsible, and they are also told that they are responsible by the society around them. Now think about how many of the mass shootings happen, and most of the mass shooters we know are white, male, young. And you don't hear that narrative or that dialogue within the white community of, I hope it's not a white person, because if it's a white person, then I'm personally responsible. And so I just want you to think through that and process how much Asians experience this locus of responsibility. And think about how, if you're sitting with an Asian client, sitting with an Asian student, how they must not only experience their own personal experience with oppression, but the oppression that the Asian community also experiences. So as we think about how can we best assess the impact of oppression with our clients and our students, what I invite you to do is to stop and listen to their narratives. Find out what's going on with them. Find out what's going on with your students. Find out what's going on with your clients, and ask them, how are they doing? Ask them about their interactions. You know, you can be very direct and use the word oppression, but it may also be just, tell me about what's going on. Tell me about your interactions with your family. Tell me about your interactions with those around you. And those stories will come out. And that's where I think we can be the most helpful as counselors.
Thank you, Dr. Chang. I also just, before I pitch this question back out to the rest of the panelists, just want to give everybody a heads up. So I think some of the sound is coming through and it's moving the videos around. So if you could do a huge favor for everybody who's in the audience, if you could go ahead and mute yourself if you're not already muted, and go ahead and turn off your video. So it does focus on the panelists, especially as we're recording today. All right, so again, thank you, Dr. Chang. I'm wondering if any of our other panelists have some particular responses to this question. I also have one that I wanted to share as well.
One other thing I would add to that is that I would also encourage self-reflection of thinking about, you know, how have you personally been impacted by oppressive experiences, and how have you managed that? And so I think it's really important as counselors for us to be self-reflective as well, because we're all part of the Asian community on this panel, but we all have different experiences. And we know that, you know, as an Asian scholar and as an Asian practitioner, it's really hard to balance between, we know that within the Asian community, there's a great deal of diversity, and each Asian group has had different experiences with systemic oppression. And so being mindful of that as well. And then also within Asian communities, there's, you know, there's conflict. You know, if you think about the Chinese and Korean and Japanese, there's a history there too in terms of colonization of Korea by Japan. So also being mindful of your own experiences and self-reflective as well.
I can add something to that as well. I think in addition to what my colleagues just mentioned, it's important to broach our identities with our clients, even if we're from the same community, because it, as Dr. Chang mentioned, we all have different experiences and we have different narratives in our lives and different cultural factors influencing us. So even before we start assessing for any impact, direct or indirect, of oppression, we need to be able to create that safety, that safe space in our settings in the classroom or in a counseling room where we can actually talk about this, talk about the differences in our identity and how that might impact our relationship before we can have our clients talk more about the impact that they've had, that the racist narrative has had on their body and on their well-being.
And I'd like to add that each individual is experiencing in a different way and a different pace. Not because I am Asian, we are all experiencing the things in the same way. And I'm thinking of myself, would I be in the same way if I were experiencing what is happening right now 10 years ago? I may not be. And then I am moving in my life, in my journey, to be more culturally inclusive and having more cultural humility. If I compare myself in the past and right now, it's different. And so when we are thinking about our clients, the people that we are going to talk to, their journey is different, where they are at and how they experience in the same, maybe this is the same boat that we are on, COVID-19, but how they are experiencing is totally different individually and systemically. So we need to remember that each journey is so different, and then there are paths, and then we are part of the generation. There are people who moved here long before, or they came here as a first generation, or they are the second generation, and then their first generation impact on them is also we need to consider.
And yeah, I think adding on to, not really adding on, but giving some more context to what Dr. Hyun just added, I'm thinking about how trauma response is also a continuum, right? So at my initial stages of my trauma response, I could be in absolute denial of what's going on. And somewhere in the middle, I could become more heightened and more aware of not just how I'm receiving trauma, how I'm receiving oppression, but how I'm also perpetrating oppression, either as a bystander or also as an active oppressor in the sub-communities within the AAPI group. So when we, right now with so much conversation going on social media, outside of social media too, of how we can contribute and how our clients are showing up either as extremely numb or enraged or silenced, all of this has to be understood in a trauma context. If I'm denying that existence, it's because this reality is extremely painful for me and my body is shutting down, my mind is shutting down, and I don't have the privilege, the resources to access reality the way some of my other counterparts from dominant identities are able to. So even appreciating that what appears as a no response from our clients is also a trauma response, is also a reflection of how especially more model minority, diplomatic minorities have been, had to pay that tax to be acculturated into dominant groups, to be silenced, to not have a response. So that too is a reflection of what is demanded of minoritized groups in our country.
I also just wanted to add to, like, if we're looking at the personal narrative of how we in and of ourselves have been impacted by the effects of the coronavirus within our community, I can, for when clients come in, especially from the AAPI community, they usually are very much on a reserved side in not wanting to initially disclose information. So for us, if using disclosure as a tool to say that how is it that we have in and of ourselves have experienced it, to make that initial connection, to create that safety that they are so needing, to then allowing them to then open up to share their narrative and their experience. Because again, they're looking to say, do you understand what I'm going through? can you validate my experience? And I think it's on us to share, if we're going back to that idea of broaching, right? How do we kind of like bring that to the forefront of the conversation at an early stage?
So I'm glad that many of the panelists mentioned broaching, because I think that certainly links directly to our next question. I also wanted to add too, I think as we think about some of these different ways that we are thinking about what minoritized and historically marginalized groups are experiencing. So I also think about, right, like we were talking about microaggressions, we're talking about systemic racism, we're talking about all these direct and indirect effects. One piece I wanted to also highlight is this notion of spirit murdering. And that concept coined by Patricia Williams, who is a critical race legal scholar, actually talks about the ways that, so the cumulative effects, right, of actually experiencing being invalidated, being rejected, being ostracized, it eventually dehumanizes some of individual or historically marginalized individuals and communities. And it also relates to long-term effects, right? So much to an effect that people, like, for example, in academia leave. So I think that's something to also be cognizant of as practitioners and as advocates and activists. And with this next question, I also wanted to highlight, so we're moving to what are some important cultural factors to broach among AAPI students, clients, and families relevant to COVID-19? And I'd like to start with Dr. Hyun.
Thank you, Dr. Chen. Thank you for having me here in this space. When I tried to think about good answers for that question, there were lots of things coming to my mind. We talked a little bit about, related to other questions so far, we talked about cultural identity development could be very different in Asian American Pacific Islander community because we are all in a different places. I would like to also highlight one of the things is that since AAPI community is so lumped together politically to be used in this systemic racism, a lot of times that when people are broaching AAPI community issues, there is a tendency to forget about the intersectionalities in AAPI community, especially like social class, religion, sex, gender, ableism, and generation, and all different kinds of people, why they are here in the United States as an Asian American community, Pacific Islanders. So I want to really emphasize that it is AAPI community is very, very diverse. The US Asian population, a record of 20 million Asian Americans trace their roots to more than 20 countries in East and Southeast Asia and Indian subcontinent, each with unique histories, cultures, languages, and other characteristics. And if you can count, like 48 countries, and then there are 19 largest origin groups together account for 94% of total Asian American population in the US. So I like to emphasize that how Asian American Pacific Islander population is so diverse in the United States. And again, and their experience of racism, whether it is individual and systemic, it's different. I want to emphasize that first of all. And also the other thing that I like to mention is the history, how they came here, and then how Asian American Pacific Islander presence in the United States. At the same time, were the history among Asian countries. I think that's also really good to remember in approaching the issues that they are experiencing. The huge part is the model minority. As we all know that, that is the concept of Asian Americans are more academically, economically, and socially successful than any other racial minority group associated with their supposedly stronger values, emphasizing hard work, perseverance, and belief in the American meritocracy. So we all know that this is a stereotype, but somehow this model minority, and we all know that this is created by the people in power to use Asian American Pacific Islander community use politically in the sense, and then perpetuate that systemic racism. And somehow, because of the culture that we have in Asia, that internal responsibility and that internal external locus of control, that we kind of internalize it as it is. And at the same time, when it is acted with the saving face culture, that I am as a person, a representative of my family, representative of Korea, representative of Asian. I try to be really nice. I should not break any law. And all these kind of narratives are interacted with that model minority expectation and model minority myth. And when you are not meeting that, of course, there's a negative impact, even though when you are meeting them, there's also negative impact in our identity. So there are a lot of, it's not just, oh, Asian Americans, you are doing great. Oh, somehow that there is a virus now, then you are actually our enemy. It is not that simple. There's a lot of intricacies, interrelated kind of aspects that historically and also systemically, and then there are a lot of isms around it. So, and it's very complicated. And again, all these are insidiously growing and built in, not, I don't want to say built in, developed in our identity, and it is really detrimental to Asian American community's identity. I also want to mention that because of that, there's because of saving face that is related to the collectivism cultural factor. There's also mental health stigma. Again, when they are reaching out to even, I mean, there is a kind of barrier. Also, there is a cultural, individual, systemic barrier for Asian American Pacific Islander population to seek out mental health. But even when they are seeking out, the superficial maybe issues and aspects are not really what's going on. There are things behind of it. So that's the thing that as a clinician, we want to really look for and work with the client and how it is related to other systems that are around that individual. And one more thing, we talked about racial microaggressions that are happening a lot in Asian American population. And the other thing that I kind of experience with kids in the schools and also families, immigrant families and parents and caregivers, the hardest part is that first of all, the racial microaggressions are very subtle. It's hard to pinpoint. And then second of all, there are a lot of people who do not know what it is. I mean, we as a professional, as a counselor educators, we may know that the term racial microaggressions, but a lot of lay people, they do not know what is this? What am I feeling right now? Why am I so frustrated here? What should I do? And again, with that internal locus of responsibility, we blame ourselves again. What did I do wrong? But again, I think that as a clinician, also we need to help out for Asian American Pacific Islander individuals. They can refer to this is what it is and what we can say about this, so that individual help will be really helpful.
Thank you, Dr. Hyun. I'm wondering if any of our other panelists have some input or insight they'd like to also share before I move to the next question.
And some of the, this may be more relevant for some of the later questions, but since Dr. Hyun brought up microaggressions, some of you may or may not realize that a brand new article came out by Sue where he and his colleagues talk about micro-interventions, ways to circumvent or address microaggressions. So I don't know if that's going to be addressed later on, but that's more of a what do you do versus say, what are the factors? But I just wanted to highlight that, and I'll send the citation for the article for those of you who might be interested.
Perhaps we can, I don't know, Dr. Chan, if you're thinking about it, we can compile a resource list. I know a lot of great questions are coming up on the chat. And I would really like, maybe if I can volunteer, we can take a screenshot of all the resources and additional ones from us and pass it on, because yeah, just wanted to say that.
Yes, yes. Thank you, Dr. Anandavalli. I'm also thinking about what we do from here, right? Because we're in this conversation right now, and I was hoping to also link in some different links for anti-racism resources in our chat box, but I also think it'd be really helpful as a follow-up, especially for anybody who wasn't here with us today. All right, so I'll go ahead and move on to the next question. So this question poses, for what reasons would it be important to address both anti-oppressive and racial healing practices in solidarity with AAPI communities during COVID-19? And I'm going to start here with Dr. Shreya Vaishnav.
Thanks, Dr. Chan. So to answer this question, I do want to highlight a couple things first. So we know that the widespread misinformation via media has led to increase in mistrust, xenophobic and xenophobic attitudes towards the Asian Americans and Pacific Islander community. Before this pandemic, we already as a community faced a lot of microaggressions that denote that we're second-class citizens or aliens in our own land, just to name a few. But following the COVID-19 outbreak, there's been an increase in reports of racial microaggressions, racism, and violence against AAPIs. So there's the Stop AAPI Hate campaign. I don't know if you've heard of it, but it has been documenting over 1,700 instances of racism that have been addressed towards this community since March. According to their campaign and website, 9 out of 10 victims were targeted because of their race, with 37% of the incidents taking place in public areas. Of all of these instances, 90% of the cases were about verbal harassment and public shunning that occurred for the community. And then finally, in 15% of the cases, victims were physically assaulted, they were cuffed or spat on, and that's just really heartbreaking, right? Other examples have included people throwing bottles at our community, the strangers invading personal space. Children are being bullied in schools, right? So a Chinese American child was overheard a peer in the classroom say, all Asians have the coronavirus. In addition to this, AAPIs have been barred from businesses, establishments, ride shares, and because of our visible appearance in the community, because of COVID-19. So of course, this has caused a lot of fear for safety and security amongst AAPIs, and it's led to a lot of racial battle fatigue, racial trauma. And when we know that when racial discrimination occurs, people of color, including AAPIs, may feel powerless and helpless. Just like with any other traumatic event, folks may feel, they may freeze, right, in their response. That's our freeze or fight or flight response to trauma. We also experience the model minority myth that a lot of my colleagues have already talked about, which can be an added pressure in figuring out how to respond to these racist acts when they occur. So this can result in a lot of rumination about the situation, negative self-evaluation because maybe of lack of action, thinking in retrospect, I wish I had done something or said something, and isolation and disconnection among many other things, right? So this combined fear of infectious disease, misrepresentation in media, racism, current social political climate has really illuminated the importance of using these culturally sensitive strategies to heal race-based trauma in our community. Therefore, it's really important to address these anti-oppressive and racial healing practices in solidarity with the AAPI community for a bunch of reasons. So first being, this really helps make the invisible visible. when subtle and overtly racist remarks and behaviors occur constantly, it starts invalidating individuals and impacts the community negatively. Additionally, there have been reports of bystanders being present during these instances, but not intervening in the situation. This can further invalidate and oppress the target. And by acknowledging and standing in solidarity with the community, we're acknowledging the pain, the hurt, and the fear that the situation has caused. Secondly, if we wish to stand in solidarity with the community and are providing essential services in any capacity, it is important that we speak up when we see something, especially because we are already internalizing this. The community already is fearful and already has that internal pressure. In fact, if we allow these incidents to happen, they're just going to get more extreme and bigger over time. Thirdly, these anti-API narratives have been created over the last few weeks and months, and they just won't disappear overnight, right? They're learned constructs, and we need community effort to work together to reverse some of these narratives that have been aimed towards the AAPI groups. And then finally, people are stronger when standing together, and our collective voices will echo louder. So it's really important that we do look at anti-oppressive and AAPI community affirming practices, because that's what's going to lead to healing for our community over time.
Thank you, Dr. Vaishnav. What about our other panelists? What are some other pieces that you're reflecting on right now in response to this question?
I think I just agree that we are stronger together. And so, you know, I think the Asian community is unique in that we have our distinctiveness with our ethnicity, but if we want to make change at the political, societal level, we have to work together. Just in terms of numbers matter.
Thank you, Dr. Chang. I actually, coincidentally, I feel like we keep doing this today, but we're spilling over into the next question every time. It's all connecting together. So the next question I would like to pose to the panel is, how can AAPI communities continue to establish racial coalitions across communities of color? And I'd like to start with Dr. S. Anandavalli here.
Thanks, Dr. Chan. I think the short answer to that is, how can we not, right, given these times? But to give a more informed perspective, I think it's important we understand why we need to do this in the first place and then address the strategies. We talk about the model minority myth, and, you know, as embarrassing or not it is to admit that when I first moved to the US about 6 years ago, when people just approached me for questions on stats and research method, assuming I would be good, I took that as a compliment, you know, because, oh, I'm supposed to be good at something. But as I progressed through my own racial identity development, I realized that there is no such thing as a positive stereotype. This idea of being a model minority is another pigeonhole or another category that some groups are pushed into to perform to the needs, perform to the expectation of hegemonic groups. So it's first important we understand there is no such thing as a positive stereotype. It might feel good, but it is still a one-dimensionalized story about a group or a collection of groups. And this model minority idea of Asian Americans and Asians is harmful because we constantly underdiagnose the concerns that this group goes through, constantly, be that at a physical level or at a mental illness level. We don't recognize suicidal tendencies. We don't recognize alcohol use disorder. We underdiagnose cancer for AAPI communities very regularly in the US. The flip side of underdiagnosing is also hypervisibility that every marginalized group faces, be that peoples of color, be that sexual orientation minorities, gender minorities. We are hypervisibilized for some very problematic reasons the COVID-19 only being the latest one, right? So this constant battle of being extremely visible for the wrong reasons and then marginalized and pushed into corners, preventing others and ourselves from having a more holistic view of ourselves is what a stereotype does. And we are not the only ones, you know. When we think about joining hands, when we think about transracial collaboration, we need to recognize we're not the only ones, you know. These kind of one-dimensionalizing diagnosis has been given historically. HIV/AIDS, as we know it now, it was not called that until 1980s. It was called as gay-related immune deficiency. What we now understand, we initially thought that the flu was, again, the smallpox and flu was again blamed to Chinese communities. And when we constantly do that, when we look at a group as a source and as only one thing, as one-dimensional, then we prevent them from being anything and impose this glass ceiling. And when we recognize we are not the only ones, that many groups have gone through this and continue to go through this, we realize it's not just an AAPI issue. This is an issue that comes from being in a society where there's a clear marginalized, clear differentiation between who the hegemonic groups are and who the minoritized groups are, who are actively being pushed to a specific category. And it's then no surprise in this context when we see, as what Dr. Chang also narrated, the historic contexts of it, it's then no surprise that we are hearing words, racist slurs such as Kung Flu, right? In this context, it's not a new thing. It's an unfortunate thing, it's a traumatizing thing, but it is also a re-traumatizing thing. We are not experiencing this in absolute terms. It's painful, we are numbing, we are not talking about it, because there's a larger historic narrative that we have gone through. It's not a first time for our group or for many groups in our country. So in this, when we look at it this way, then we don't have a choice but to join hands and understand that mass shooting, blaming groups for triggering diseases, blaming groups for being extremely violent, this is all a reflection of one-dimensionalizing minoritized groups. So how do we then respond to that? How we respond to that is, I guess, a three-step process. Some of it is being addressed in our own webinar right now, is to acknowledge, right? Well-known scholar Ibram Kendi talks about how you cannot start the process until you admit we have a problem. We keep thinking of racist as an adjective, as an identity. It is not an identity. So it is an act that we engage in. It's a thought we engage in. So it is not a one-timer thing. I'm not a racist, so we don't get a lifetime membership to it. No, you have to actively choose that. And when you abstain from choosing that, you're either a bystander or you're racist. So it's not a one-time, it's not a platinum membership. No, it's not. So, so we have to start with admitting that we have a problem and we have biases, and that we have to start somewhere, that it is not okay that we are going through this. And, you know, as much as we acknowledge that we are the minoritized group, the AAPI group, in my opinion, also has to acknowledge there are hierarchies within our own group, right? So I'm an upper caste Hindu in India, and I know what my community members are doing and contributing to the lives of Dalits and Muslims there. Similarly, I'm sure many other Asian community members can talk about what it means to be of Korean descent in Japan, what it means to be a Hindu in Pakistan, or so many other combinations. So we have to acknowledge that we too are not just occupying one identity of the oppressed, we are also contributing to perpetuation of the system. And once we acknowledge, then we can talk about educating ourselves. And as we correctly pointed out in this panel, that we cannot tax our clients, we cannot tax our community members to teach us just because we have a sudden awareness. We have to go and gain that knowledge through making mistakes, you know, the sense of fragility that I have to get it right the first time. That is not how it works. That's not how it works for anybody, be that even for persons of color, even for AAPI members. We have to go and be vulnerable, be open to quietening ourselves and listening. and reading materials and watching things and experimenting and pushing ourselves out of our comfort zone. And once we have this intersecting place of awareness and educating, we have to then do the activation, right? We have to convert that into some kind of a movement. And it doesn't have to be only a social media visible way. It doesn't have to only be hood feminism. It doesn't have to be only street advocacy. Find out what your strength is, right? As supervisors, what do we tell our supervisees in moments of challenge? Use your skill, that is your strength. Reflect or ask a question or validate, but find out what your strength is. Is it academic work? Is it researching? Is it anti-oppressive counseling? Is it that unique, stellar ability to argue with people on Facebook? Whatever it is, go and use it to convert your awareness, convert your education. And that's the only way we can expand ourselves beyond what my physical appearance is. So I may belong to the Asian community, but it directly affects me when I'm silent, when members of the queer community are attacked by police brutality. It directly affects me when I watch somebody receive a positive stereotype and I don't say anything to challenge it. So we have to expand ourselves, and only then can we recognize it's a microaggression. It's only when we acknowledge and expand that it's a microaggression, when we are given these kind of comments, can we start the activation process. So it's a complex one, but surely the process is starting when we acknowledge that it's not an AIPI specific issue of racism and xenophobia and xenophobia. It's everybody's issue. When one of us is hurt, one of us is challenged.
I'm wondering if any of our other panelists would like to also share some additional insights in response to this question. Okay. So I appreciate so much of Dr. S. Anandavalli's points, because in so many ways, right, like we're thinking about the proximity to whiteness and how white supremacy can function to not only distract us, but to disrupt so many of the racial coalitions we're building. So I appreciate you all so much. Now I'm gonna move to the last question, and then we'll reserve the last 15 minutes for Q&A. So the last question here that I'm posing is, moving forward, how can professional counselors establish anti-racist, activist, and advocacy practices at multiple systemic levels for AAPI communities? And I'd like to start with Dr. Monica Band.
Thank you so much. I had been thinking about this as a professional and practicing counselor. I often go back to the process, as many of us do. And I think about, in many ways, how the traditional form of therapy as we know it has a very Eurocentric, westernized approach to healing in relation to roots in heteronormativity and patriarchy that needs to be addressed first and foremost within us, and as we, as counselor educators, also begin to perpetuate this model. This model of healing was not created for or made by people of color. And by understanding that and saying that out loud, I think both to students and then also to ourselves as we go into a session with a client or clients is going to be important, by recognizing that at that moment when we sit on that side of the couch, we assume a position of power and privilege within that. Individually, though, I know it is more complex than that as we begin to think about our own positionality and the varying seen and unseen intersectional identities that we hold. And so in that, I echo some of the sentiments that I made earlier pertaining to the AAPI community, which is to begin to understand how we individually have reaped the benefits of being white adjacent and leaning into, perhaps unbeknownst to us at the time, but now known to us, reap the benefits and privileges of being a part of the model minority? And how are we then perpetuating systems of oppression within us and then noticing that in our clients? Sometimes these things are so covert we don't even know them or recognize them, but one way to go about that is to begin to dismantle some of the values or the messages that we have received from the various systems that we operate in. This can be anything from how we view ourselves and our bodies or our gender or what we view as attractive or acceptable, and how we then begin to operate in relation to some of these values. And I know that's not an exhaustive list, but I think that's somewhat of a good place to start. And for clients, how can we begin to catch that for them as well? When we recognize that perhaps some of that critical voice or that shame or some of the ways in which they're feeling not only is valid, but maybe some of the distress that they're experiencing isn't actually coming, you know, or it's being internalized, but it's not originally coming from them. So first and foremost, when I think about how can professional counselors establish anti-racist practices, we need to begin to understand how we've internalized whiteness ourselves and the oppression that follows that, because we may be doing it and not even recognizing it, because we are operating in a system, again, of therapy that was not originally prescribed to us. That in of itself needs to be, I think, deconstructed in some ways, is that process and that engagement, the structure of therapy in of itself. And so I take pause in that as a practitioner to think, how then can we spread that message to other people who are seeing clients, to be able to understand that sort of the very formative way or formal structural way that we engage with clients may not necessarily be the most accurate or the most effective. The other thing that I'm thinking of is, how can we begin to navigate our clients' symptoms in relation to their activism? How can we support our clients when they are going out active and being activists themselves? And it's a kind of new spin on providing therapy, but in a lot of ways in the past several days, I've had to engage with folks who are being tear gassed and who are hearing explosions outside their window while we do sessions, and who are going right after our session to go into a protest. And I think about how different and unique that is. And while hopeful, I as a therapist want to be thinking about, how do I then prepare and aid my client through this, knowing that maybe that they're experiencing anxiety, they have social anxiety, or yet they are still ready and willing to be a part of this movement. And there's something really empowering about that process as well. And so it's a really interesting spin on not just focusing on emotional or symptom regulation, but how do these symptoms directly impact or intersect with one's identity as an activist in many ways. And that's something that I've been trying to understand the best I can during the time of course, COVID and staying safe, but also in helping others simultaneously. So acknowledging that as well. So there's just a few things that come to the top of my mind, and I'll leave it to my esteemed colleagues to fill in the blanks and the rest.
Yes, Dr. Ban was talking, it reminded me of the ACA advocacy competencies, because so much of what we teach about client work is really one-on-one, but if you want to do advocacy work, you have to be willing to leave the office. And if you think about the advocacy competencies, they do talk about the continuum of, part of our job as counselors is to empower our clients to do the work that they need to do and that they want to do. And part of our work as counselors is to be activists and advocates. And so for those of you who may not have known, which I didn't know until recently, is that the ACA advocacy competencies have been revised. And unfortunately, they didn't do a very good job of advertising that they were revised, but the revised edition is actually on the website. So if you type in ACA advocacy competencies, you'll see the revisions, which are more concrete and provide more direction, I believe. So, and they align very nicely with Dr. Ban's comment about how do we support our clients in a different way now.
Before we move to the Q&A, do any of the other panelists have any other remarks that they'd like to share?
I was just going to also comment on the need for us. We've seen within our social context right now this checking in the need to be checking in specifically on members of our Black community, and not just doing it as lip service for the sake of what's happening, but really going deeper and saying, not just how are you, but what could I do for you in the space that we're navigating, and how can we navigate the space together? And similarly, if we're looking at this for the AAPI community, is to saying to those who are or practitioners or educators who are on the front lines of doing this difficult work, having these difficult conversations, is to being supportive and checking in on each other, and
you gotta move back.
Encouraging each other.
You move back?
So sorry, someone has their volume on, or their mic on, sorry, but just to continue the narrative of saying, when we check in, to also be sure to check in on ourselves, where we are, what we're feeling, what we're experiencing in this moment. It is draining, I would say personally, to be on social media and having to defend positions if I would define it as of ignorance, right? Or defining positions where people are blinded by what is actively taking place, and for me to say, am I going to choose to invest in this person or choose to walk away at this point? But then what am I doing? Is it am I losing in terms of not engaging with that individual? Here's a great opportunity to potentially educate and doing my job as an advocate, right? So balancing those different perspectives, I think, is important. And so it's important that we, as a profession who value wellness and promote wellness within our community, that we also do so for ourselves and for each other.
Okay, so I'm gonna start with one of the first questions that we had early on for our Q&A. So now we're in the Q&A session, but how would you explain issues of racial discrimination to young children and raise their societal awareness? Panel, what do you think?
I think the starting point is acknowledging that children do see racial issues and racial bias much better than what we give them credit for. The number of children who ask questions about how we treat differently, I know that a few of my friends who have toddlers, who have elementary school children, they notice hairstyle, they notice how communication looks different. So the first step is to welcome these questions in a safe and inviting way, as opposed to punishing them or silencing them further. So curiosity-led, respectful questions that children do ask is a great starting point. So children already initiate this conversation. I think it's our job to respond to them as opposed to silencing them. And I know in the chat box, great many tools are listed where through books, through stories, through everyday experiences, we can normalize that diversity is a very real presence in our life. And there are some ways in which we are different, and we don't have to gloss over the differences through everybody's equal, everybody's same. And at the same time, recognize that there are some core human experiences of emotions, joy, sadness, fear, that all children experience. And yet there are some respectable differences too. So through these books and audios and videos, we don't have to initiate. They have done that job already for us through their respectful questioning to adults and grown-ups around them.
I'd like to add also that we all know that racism, I mean, our even young, very young child, they understand what racism is. I mean, of course, that the term they may not, but they are experiencing it and then they express it. So it is, I don't think that the solution is to hide or delay the conversation. Well, we need to actually have that conversation with kids, and especially a lot of times that it is displayed as a bullying, it is displayed as being rude, and it is happening. So I like to have maybe explicit conversation what it is and how it is impacting our children and how it is impacting the kid who is experiencing it, and we can also discuss what they can do about it if there is any goal for change. And I'd like to also emphasize that in that process, we need to engage with the parents and caregivers and the families as well, because a lot of times that our kids are experiencing from their closest system, which is the family and their society, which is the school, their friends, and then their family members and their relatives. So also having the conversation or reaching out to or training or providing some education for the community and then have an explicit dialogue about the racism is important.
Okay, so I'm also going to bring in another question here. And I think this is also, I'm also looking at the time, and I also recognize our panelists and our audience members also have other commitments. So I wanted to reach out and check on this question: how can ACA support these important issues, and what specifically would you like to see ACA do?
You know, that's a great question. And I think it's interesting because one of the things that I want to do a shout out to that I'm so grateful is that I see that Heather Shreya, I don't know if she's still on the call, but our current president of ACA was on here. And then so is Dr. Sue Pressman, who is the president-elect. And so that's heartwarming to know that this panel, which you know, they could have, the both of them are extremely busy. They could have easily said, good job, I'm glad you guys are doing it, but they actually showed up. So I want to first of all tell Heather and Sue, thank you for being here. What I would like personally to see ACA do is I think that ACA can be responsive and have been responsive. What I would like them to do is take more action. I think that ACA has done a relatively good job of acknowledging racism, acknowledging police brutality, acknowledging that we're all going through a difficult time. And now what I would like to do is have them take the next step of activism and action. I will say that having been part of the institutional leadership program within ACA, I have been impressed with how they lobby at the federal level. With legislative, they have a lobbyist, you know, they're responsive, and I want to know what they're doing to directly address the discrimination within the Asian population, the hurt, the pain that that Black clients, Black students are going through right now. And I want to see more than just a resource list. I feel like every other counseling organization and every other organization has been posting resource lists, which are wonderful, but as counselor educators, I know how to find those things. I can do that, but what can we do to have a call to action that brings people together? That's more than just marching on Washington. That's just more than putting something on the website. And I'm not sure what the answer is yet. I don't have an answer. one of the things that I would like to share that some of you may know is that, I'm really proud to be a member of ARC, the Association for Assessment and Research and Evaluation. One of the things that we did is we put money behind our words. Because of the conference being canceled at ACA, our fall conference is going to be online. ARC is taking those funds that we would have spent on travel for the EC, and we are giving it directly back to our membership in the forms of grants. And we're going to have a call for grant proposals, which will directly fund research and also assessment that's related to COVID and racial discrimination. And so, as a small division within AARC, we don't do a lot of direct client work, but what we do is we support assessment and research. And so we're putting money behind what we believe in. And so I'd love to see ACA do something that's a little bit more proactive. But I want to start off saying I am very pleased with ACA in general. I feel like they are responsive, and I'm very pleased to have a president-elect who found this topic important enough to be a part of this webinar today. And what can we do? And I don't have an answer other than I would like to see more activism.
I also wanted to pair together with Dr. Chang's comment. I also am thankful, especially seeing the continuity of our leaders here with us, right? And that's been so much at the forefront of the work that I do, right? It's like not only speaking about it, but being able to do the work behind the scenes, being able to put the mechanisms together. And I also wanted to highlight, that we have continuity. We have Dr. Heather Treeple here with us. We have Dr. Sue Pressman here with us, and we have President-elect of ACA, Dr. Kent Butler here with us. So
yes, thank you. Thank you, Kent, too. I'm sorry I missed you.
That's totally okay, no worries. And then the other piece is thinking about how can we all build community together and build it in these structures of anti-racism, structures of activism within all of our 18 divisions, right, in ACA, and all of our regions and all of our state branches. We're seeing that come to light, and I think we all can have a stake in it.
So being mindful of the time, I would like to formally thank all of our panelists, Drs. Anandavalli, Harrichand, Vaishnav, Chang, Hyun, and Ban for their contributions to the discussion today. And thank you, Dr. Chan, so much for wonderfully moderating this panel. I certainly learned a lot from you all. Thank you, AMCD members and guests, for attending today. We do want to inform you that there are 2 upcoming AMCD events that we hope you will also attend. First is the AMCD Mentoring Program Committee hosting the AMCD Mentee Research Symposium tomorrow on Friday, June the 5th from 1 p.m. to 3:30 p.m. Eastern Time. The research symposium is designed to highlight the research of our 2020 AMCD mentees, and you can register to attend that event on the AMCD Eventbrite page. Additionally, on June 19th from 3 to 4 p.m. Central Time, Dr. Audrey Elian, chair of the Public Policy and Legislation Committee of AMCD, will moderate the Architectural Construct of Advocacy for Counseling Professionals with Diana Lofton, the Government Affairs Specialist for the American Counseling Association. Everyone within 3 days of this webinar, you will receive an evaluation link that should be completed no later than 2 weeks from today, and then you will receive your certificates via email. Thank you all again for attending, and have a wonderful rest of your day.